COVID-19 has truly made a profound impact on our daily lives, both here in Charlottesville and around the world. At times, we may feel overwhelmed and confused by the information we receive from the news, social media, friends, or family. You may be asking yourself, do I have COVID? Who needs to be isolated? Who needs to go to the hospital? What even happens in the hospital? Well, today, UVA MiniMed plans to address these concerns and hopefully leave you feeling a little bit more informed. Joining me are two physicians who are on the front line and working tirelessly at UVA to take care of patients in our community. I'm excited to be here with Dr. Mark Cohee, the Inpatient Medical Director for the Family Medicine Hospital Service. Thank you, Dr. Cohee, for your time. I'm also happy to welcome one of UVA's own medical school alumni, Dr. Alex Lawson, who is one of our hospitalists from the internal medicine department, meaning he sees patients who are admitted to the hospital and not in an office setting. Dr. Lawson went on to attend residency here and continues to serve Charlottesville to this day. And thank you, Dr. Lawson, for joining us. Let's get started. So my first question is to Dr. Lawson. How do I know if I might have COVID? And what signs and symptoms should I look out for?
Sure. So, I think as most everyone knows that COVID-19 is a respiratory virus and is part of this group of viruses that are called coronaviruses, which affect humans and also affect animals. I think also, as everyone knows, that the virus is highly contagious and is primarily transmitted by person-to-person contact via respiratory droplets. What that means is that the transmission occurs from person-to-person contact when an infected person coughs, when they sneeze, or even when they talk in close proximity to another person. These respiratory droplets can also land on surfaces and then lead to a transmission if a person were to touch something that an infected person touched and then touch their face. That seems to be certainly less common though. COVID, being a respiratory virus, obviously primarily affects the lungs, which causes pneumonia. The usual symptoms of which are fever, cough, shortness of breath, but also we sometimes see other symptoms like chills, fatigue, headaches, sore throat, and then GI symptoms like nausea, vomiting, and diarrhea. Most people, when they do get infected, have symptoms about 4 to 5 days after they're exposed. But one of the challenges with this disease is that the course is really highly variable. Most people with COVID only have mild symptoms, usually mild respiratory symptoms, but some can be completely asymptomatic. And then unfortunately, as you know, a small percentage become very critically ill. One of the major challenges that we face in preventing the spread of COVID is that it's possible for an infected person to transmit the virus to other people in the period before they develop symptoms. And that's where the social distancing recommendations come in. It helps you avoid becoming sick if you happen to be around someone who doesn't yet realize that they've contracted the virus, and also vice versa.
So let's say I have some of those symptoms you've mentioned. So fever, cough, shortness of breath. Should I get tested?
So testing is a really complicated topic. And part of that is because we still don't have the ability to test absolutely everyone. But certainly anyone who's concerned that they may have COVID-19 should get in contact with their primary care doctor. Most doctors' offices now have the ability to perform tests. And if they don't, they can refer patients to UVA's outpatient COVID clinics for testing. And there's certainly a group of people who should be extra cautious, which would be those who are at the highest risk of severe disease, which would be people who are older individuals, and really in particular people who have pre-existing medical problems, which really can be just about anything from heart disease, kidney disease, lung disease, high blood pressure, and certainly people who have compromised immune systems.
And then my next question is for Dr. Cohee. As with other health systems across the U.S., it took a lot of planning to prepare UVA for this pandemic. Could you take us behind the scenes and talk about what measures were taken?
Well, one thing that was very lucky for our area is that we weren't the first area hit by the virus. So we had a little time to get ready and see what kinds of actions made a difference in other centers as they prepared as well. And one thing that immediately stood out is the more our health system could prepare for the pandemic, the better off we'd be. So this took a lot of work preparing for every possible way the pandemic could impact Charlottesville. This could be from best case scenarios to worst case scenarios and everywhere in between. So this meant having a much more fluid staffing model than we could have, with a few people specialized in taking care of COVID-19 infected patients, and then also be able to rapidly scale up if we had more patients needing more care. We've been lucky in our community so far that everyone's working to stay safe, stay at home, keep distancing, and this has meant we've been able to work with a smaller team still, but we remain prepared to step up if needed. There are lots of parts of this that I haven't been involved with as well. That includes kind of universal masking, health checks on employees, health checks on everyone coming into the office, environmental safety, expedited testing, and a huge effort to do telemedicine to help patients to get care even without leaving their own homes. There are also a lot of processes in disseminating information to both doctors and patients and other healthcare workers to a totally new disease that's pretty rapidly evolving, and keeping everyone up to date as we continue to learn more. A lot of this is very role dependent, so each department has really stepped up with helping provide the education needed for every role. Some things like how to properly use our PPE, that's our personal protective equipment like masks, gowns, and gloves, that's universal, and so the hospital provided refreshers for all employees for that. One thing I already mentioned was testing, but I'd like to spend a little more time on that. Again, going back to things we learned from other areas impacted before us by the virus, testing is hugely helpful to keep people safe. And while we'd love to test everyone who wanted the test, it's still not within our capability. However, at the point where we can test all of our healthcare workers, most people with symptoms, and hopefully soon every patient admitted to the hospital. And while the test used to take almost a week to come back, now we can offer results within a few hours for most patients. And what that means is that we're at a point where we can feel much more confident that our patients with COVID-19 and our patients without COVID-19 don't really have opportunities to meet or mix in the hospital, even if they're both admitted to the hospital.
And speaking of the hospital, if I'm experiencing symptoms of COVID, how do I know if I should go to the hospital or if I can just wait it out at home?
So that's also a really challenging question, and is kind of really hard to answer. And so, I think there are a couple important things to keep in mind, which is that really anyone who has concern about their symptoms should contact their doctor and perhaps schedule at least a phone call or a in-person evaluation if that's possible. And then there's a few cases, for example, if you're having trouble breathing, if you're having chest pain, you should probably go straight to the emergency department. As to when people get to the emergency department, we're also really challenged in deciding who to admit to the hospital. So that's really kind of done on a case-by-case basis. But to speak generally, anyone who has moderate or really severe signs of COVID, which I would say kind of most notably, to point at one thing, would be low levels of oxygen in the blood, or as a second, people who we think are at really high risk of having a severe course of COVID, we generally admit and care for those patients in the hospital. For the people who stay home, so people who do think they have COVID, and again, not everyone unfortunately can be tested, but if you do think you have the symptoms, you should self-quarantine, meaning avoiding contact with other people. The best recommendations on this probably come from the CDC, and they currently recommend that you isolate yourself for a period of 10 days since the time you first started to develop symptoms, and that you should also have complete resolution of your symptoms, including the absence of fever for 3 days before you start to again be around other people. The other case is that for anyone who has had close contact or know that they've been exposed to someone who has COVID, should also stay home in quarantine for 14 days after the exposure. The one exception would be if you're in an area where you can have 2 tests. If both those tests come back negative and they're done at least 24 hours apart, it's generally felt to be safe to sort of re-engage with other people, keeping in mind the usual social distancing. And these are all things that are obviously super important to help further prevent the spread of the disease.
And switching gears, let's say we're in the hospital and a patient is suspected to have COVID. We hear lots of talk on the news about patients needing ventilators, but for those who do not require care in the intensive care unit, what kind of management do they receive?
Yeah, so most patients that we see in the emergency department, the symptom that got them to the emergency department was that they were having shortness of breath or feeling some difficulty breathing. When people arrive to the emergency department, they all get asked questions about their symptoms, whether or not they've traveled, if they've had close contact to anyone who has COVID. And these are the types of questions that help us decide who's at risk and then who we need to test. In most cases, we can do rapid testing while the patient remains in the emergency department. And in many cases, we have those results back in about an hour. And then keeping sort of that in mind, and then their symptoms and just really kind of how they're doing overall after the emergency physicians have had a chance to evaluate them, then we can make triage decisions about whether that's someone who can go home or whether we need to care for them in the hospital. So not everyone who tests positive for COVID needs to be admitted to the hospital. If people are felt to have mild symptoms, generally what we do is instruct them on how they can return home safely with instructions on isolation and then some specific things that they should watch out for to give them a sense of when they should come back to the hospital if their symptoms are worsening. The people who test positive who we think need to be in the hospital but don't require intensive care are what you were asking about. So those patients are admitted to a part of the hospital called the acute care floor. And we're very lucky in that currently patients who either have or are suspected to have COVID get cared for in UVA's new hospital expansion called the South Tower, which is really an entirely separate facility from the main hospital, which lets us kind of keep the two populations of patients as well as the staff separate. And then most patients in the hospital who have COVID are cared for by hospitalists, which are internal medicine doctors who specialize specifically in the care of hospitalized patients, which is what I do. And then in some cases, they are assisted by the internal medicine residents who are doctors that have gone through med school, but are still undergoing some additional training. And those residents also take care of patients in the main hospital. We also, sometimes need to involve some other specialists to manage conditions that a patient may be experiencing, if they're having a change in their heart or kidney function. And there's lots of other examples of kind of what that may entail. When we actually care for patients with COVID in the hospital, that's really only, unfortunately, supportive care, meaning we use interventions like oxygen. If you have low levels of oxygen in the blood, we'll use things like IV fluids to treat dehydration. Sometimes we really have to do the opposite and use medications that are called diuretics, which can help prevent the accumulation of fluid in the lungs. The other thing that the term supportive care implies, unfortunately, is that we don't yet have any specific therapies that target the virus yet, although UVA is involved in several clinical trials that all aim to really find better treatments than what we have now. And so in some, or actually even in many cases, patients admitted to the hospital may be candidates to enroll in these trials. And that's, of course, really entirely optional.
And with all the talk about COVID, the need for social isolation, as well as some people requiring hospitalization, there are many people in the community who don't have COVID, but might understandably be afraid to go to the hospital for other conditions because they're scared they might get COVID. What assurances could you offer our listeners that you are able to safely care for patients without COVID needing hospitalization at this time?
So first off, I'm always really happy to hear that people's first response is, should I leave the safety of my home? Because that's a huge change for so many of us. And so in many instances, that's a great question to ask yourself, but your health isn't always something that can be ignored. And we've also seen the consequences of medical conditions being ignored for too long in this pandemic. The CDC has issued a report, and it seems that in some areas, the number of people dying from things other than COVID-19 has risen as much as 50%. And so that's essentially extra deaths, not from COVID-19, but from other medical conditions that just weren't cared for during this time. And so first and foremost, don't hesitate to call 911, go to the ER if you're having worrying symptoms like chest pain, trouble breathing, or stroke-like symptoms like trouble talking or moving part of your body. And secondly, now is time to really take control of any chronic health issues. So we're staying open, our clinics are staffed, the hospital is ready to take care of you if needed. And we're even offering telemedicine visits like video visits over your phone to help keep control of chronic medical issues. So you don't have to come physically to the hospital. Oftentimes you can do things from your home and still take care of your health. And if you do need to come to the emergency room or a doctor's office or be admitted to the hospital, know that there's a lot of effort going into protecting you from COVID-19. So every area is doing its best to have any patient with symptoms concerning for COVID-19 seen in a quarantined area to keep our hospital area safe. And we're social distancing even in the hospital. Everyone is given a mask to wear. And we've eliminated kind of physical check-in lines. So we're making sure that everything is clean and within the hospital. So my main job has been caring for patients admitted to the hospital without COVID-19. And for the most part, things are very business as usual. So we've always worked hard to prevent the spread of illnesses in our hospital. And now we have a physically separate ward for everyone that has COVID-19. We're still giving masks to everyone admitted, even though we're hopeful that no one is in the hospital in those areas with COVID-19. And one area I particularly want to draw attention to, though, is mental health. It's no big surprise in a time of extreme stress and anxiety for the world that we're seeing a big increase in mental health disease as well. And I wanted to spend a few moments stressing that this is just as much of a concern as any other health risk I've mentioned before. So our psychiatrists, psychologists, therapists, and counselors have been amazing during this time. They have options for telephone visits, video visits, and in-person visits with our providers. And please don't hesitate to reach out to either your primary care doctor or psychiatrist or psychologist if you find yourself in need. A lot of our own employees are similarly affected, and for UVA employees, there's also our Faculty Employment and Assistance Program known as FEAP. That's a great resource. As I said before, now is really a time to focus on becoming the most healthy version of yourself, and our providers are here to help make that happen.
And speaking of mental health, I just wanted to end this segment by asking, how are you both holding up?
Yeah, so I mean, this has certainly been challenging, but I feel very fortunate, to be at UVA for, really a few reasons. First, as Mark said, we haven't seen the infection rates anywhere near what other parts of the country have. And we also, I think, started really early, kind of making plans as an institution on how we were going to change our operations so we could both safely and really effectively take care of these patients. And then, we also have really adequate supplies of our personal protective equipment, which is obviously an extremely important part of being able to safely care for these patients in the hospital who have COVID. The hardest aspect that I sort of see from my perspective is really what both patients and families go through. In order to keep everyone safe, the hospital unfortunately has to impose limitations on visitors. And so just to see patients and their families isolated while people are in the hospital is obviously really challenging. And that also makes it challenging for the people who are caring for these patients, because normally the way that we kind of keep everyone on the same page is by having people visit and meeting and spending lots of time talking at the bedside, which we just unfortunately cannot do in the same way. So it's really changed our workflow. In my mind, the people who I think by far have the most challenging role in this are our nurses. They're certainly at least here, the healthcare providers who are, at the highest risk in caring for patients who have this disease, since they're the ones who are spending, the most time with the patients. I think they're the ones who, really have provided the most support to the patients. And, from kind of everything I've seen, every member of our staff, our nurses especially, have really done a pretty incredible job with everything.
Yeah, I think I would agree and just echo the difficulty I've witnessed as well, even with patients without COVID-19, just the fact that coming for visits or coming to the hospital and being hospitalized and not having the support of friends and family has been very hard for patients. And it's been something that, the more we're able to help people connect even virtually like this over video, over phone, can make a huge difference. And so, if you know a loved one or know a friend or someone of that nature in the hospital, or just feel free to reach out and call. And it makes a huge difference to hear from people. And I think personally, I've definitely realized how important a lot of kind of the real basics are. I'll confess the first week of doing all of this, I really struggled, and I was barely sleeping, and I wasn't exercising, and it made a big impact. And so I've been very, very focused that even though schedules are very different, life is very, very different, we're not seeing friends and family as much, just being really good about making sure I'm eating healthy, sleeping well, making sure I'm still, having social connections, even if it's over the phone or things like that, and finding ways to find mental health balance and things like that. And that's a challenge, and I understand that everybody has a different path through this, but definitely finding ways to kind of live life as normally as you can, given all the restrictions we're going through, can make a big difference too. So.
Well, I'm glad to hear that you both are adjusting and coping well during this pandemic. Thank you both for sharing your thoughts and experiences. We appreciate everything you do, from taking care of patients during this pandemic to helping us to stay informed. For our Mini-Med listeners, we will have resources available on the website if you want more information about what we have talked about today. Also, you can send us any questions you may have in the link provided on the website. And that wraps up another session of UVA Mini-Med. Thank you for listening.
Thank you.
Thank you.